And welcome to the Dr. Bob Show. We'll be spending most of this show talking about psoriasis. There are new findings in psoriasis, new medications that can change people's life. Sometimes psoriasis makes people where they don't want to get out in public. New medicines may change your life. There's also an association of psoriasis with some other important diseases. So a lot of information for you. My guest is Dr. Meredith Overholt, board-certified dermatologist, and she'll be talking to us about what's new in psoriasis. Hello, I'm Dr. Robert Overholt, and I'll be your host for the next 30 minutes on the Dr. Bob Show. Later on, we'll be talking about something very interesting to my heart. Why are more people becoming allergic and we have better medicines that are over the counter, yet people are not experiencing well-being that they want? What can they do about those medicines? What needs to be done if you have allergies? We're going to be talking about that, why people are having more allergies, and what we can do to change their lives. A lot of information for you. You'll want to stay tuned. We're talking with Dr. Meredith Overholt, board-certified dermatologist. We're talking about psoriasis. Meredith, welcome to the Dr. Bob Show.
Thanks.
What is psoriasis?
Psoriasis is an autoimmune inflammatory disease that's actually multi-system. But of course, we think of it as being primarily a skin disease and to some extent an arthritis disease.
So how have our thoughts over the years changed about psoriasis?
Well, science has kind of finally caught up to observations, which happens a lot. And originally, psoriasis was just really thought to be a skin disease. And one of the things that was well known about it was that the skin seemed to turn over more rapidly than normal, hyperproliferative disease. And that idea was supported when methotrexate came out, one of the early chemotherapeutic agents. And when that was given to people with cancer who happened to have psoriasis, they got better. And that seemed to support that idea. Well, then another drug came along, Neoral or cyclosporin, which was given to a lot of patients with transplants. And if those patients had psoriasis, their psoriasis got better.
Bingo. So we began to think about
more of the immune system being involved.
Yeah.
Exactly. So how exactly the immune system is involved, though, became the next frontier to see exactly how that would work. Okay. So it turns out that psoriasis is inherited. But it requires a multitude of genes, probably at least 10, in order to inherit it. And a lot of people, probably 10% of our population, actually has enough of the genes to have psoriasis, but only 3% of the population actually does. Although, really, when you think about it, 3% of the population is a huge number that is affected by psoriasis.
What is the psyche of people with psoriasis? Because if there's going to be new treatment that's so good, does everybody come, and how do they feel? I always think of people really hiding themselves.
Right. Well, and that's why I was glad that you asked me to talk about psoriasis today, because psoriasis has been recognized now as I mentioned, kind of a multi-system disease. It does certainly affect the skin and joints, but turns out, like other inflammatory diseases, that inflammation is being more and more associated with other problems. So as you're probably familiar with a lot of inflammatory diseases, we're talking about increased risk of heart disease primarily. So it turns out that if you have moderate to severe psoriasis, that your risk of having a major cardiac event is actually 58% higher than a person of similar age and sex that does not have psoriasis. So very significant.
So it's a wake-up call.
It really
for
is.
people that have psoriasis, that you need to be sure that your heart markers are in good shape, cholesterol, blood vessels, that sort of stuff.
All of that, 43% increased risk of stroke. It's been associated with what's referred to as metabolic syndrome, which are people who tend to be obese, tend to have high blood pressure, may have type 2 diabetes, with those people. So all of that goes along with having psoriasis, and it's probably this inflammation connection that's being found.
Wow, so the message right now is, if you've got psoriasis, you may have these other problems that we need to work on, or if we work on these other problems, it may help psoriasis?
Well, it does tend to cluster in people with more moderate to severe disease. So remember, if you just have a little patch on one elbow or a small patch on the back of the scalp, that's referred to as mild psoriasis when it's under 3% of the body surface area. So when we get between 3 and 10%, this is moderate, and above 10% severe. So as we're getting into those bigger numbers and more effect on the skin, that's a marker for these elevated risks. And then you asked about psyche, and certainly it turns out that patients with psoriasis also have a much higher rate of depression. Okay, and the question becomes, is that endogenous or exogenous? And what I mean by that is, do those chemicals rolling around in their body in that inflammation state actually produce the depression itself, or is it just the quality of life of the psoriatic that is really, causing the depression?
Do we know the answer on that? Because certainly if somebody has severe psoriasis, they may not want to get out and see people, and they may get depressed. Or how do we know?
Well, I don't know that you can divide it. You just know that it is
happens.
Certainly a characteristic. And we do know that people with psoriasis who fill out quality of life surveys, these are a tool that are used to assess the degree to which many different health issues impact quality of life. And if you look at the score that people with severe psoriasis give, it's the same score as people with blindness.
Wow. Wow.
Yeah.
So quality of life in people with psoriasis is the same as if you were blind.
That is how they feel.
And it's associated, you said, with maybe depression, maybe obesity, maybe metabolic syndrome, maybe heart disease, strokes. That's really big time. Is that new findings? Sort of?
These are relatively new findings, and so if your dermatologist hasn't gone into this with you, this
Sure.
is fairly new information, especially, we're trying to get at some of the psoriatics who are out there who maybe saw their dermatologist 10 or 15 years ago, were given a few creams that they didn't really find very effective and have sort of given up. So that patient really needs to be aware that there are these new bits of information out there that really impact their need to go ahead and seek therapy, because as you asked, does decreasing inflammation and treating your psoriasis actually result in reduction of these risks? Well, when something is new information, oftentimes the studies aren't out there yet to completely prove that. However, there are some good studies from the rheumatologic literature about folks with rheumatoid arthritis for whom a lot of the same information is true. Okay, so for those people, there are some studies that show that reduction of inflammation in people with rheumatoid arthritis does reduce cardiovascular risk.
This is life-changing that we're talking about. This is people that may have been hiding themselves with a little bit of psoriasis that need to understand the comorbidities, we call it. Quickly, I've heard about psoriatic psoriasis arthritis.
Yes.
Psoriatic arthritis, is that a special kind of arthritis?
Well, it's very similar. If one takes an x-ray, it looks very much like rheumatoid arthritis. So it's what's referred to as an inflammatory destructive arthritis. So when this disease is present, it causes joint damage.
Now, okay. I've seen some people on television that had that on the advertising,
Right.
and the medicine makes them well.
Right.
Are some of those medicines safe or unsafe? You hear on television.
Well, certainly, you see those ads, and the ads make you feel like these things are extremely dangerous, perhaps deadly.
But frequently they are not, and that's what we're going to be talking about when we come back. Newer medicines help psoriasis. People with psoriasis have problems that they need to correct. So we're going to see what the new medicines are and the new treatment and see what we can do to help. How exciting. You want to stay tuned. We're talking with Dr. Meredith Overholt, board-certified dermatologist, skin specialist. We're talking about psoriasis, autoimmune illness, new medicines, new concepts, new ways that we can help people, and there's comorbid problems, associated illnesses, diabetes, heart disease, stroke, metabolic syndrome, arthritis. So all of these things, so important. If you've got psoriasis, check in with your doctor. Meredith, let's start talking about treatment. I know are there different levels of psoriasis?
Yes, we talk about mild, moderate, and severe psoriasis. Mild being generally under 3% of the surface area of the body. 1% is your palm without your fingers, so you can figure that out. Yeah, so 3% would be 3 of those. So less than that, mild psoriasis. Moderate, 3 to 10%, and severe, greater than 10%. But, sometimes patients have psoriasis on their palms and soles, or what we say inverse psoriasis affecting the groin and axillas. And believe me, people, even if their surface area is mild, those can be very particularly disabling conditions. Okay, so with these guidelines in mind, people generally will choose more localized therapies or more systemic therapies. Certainly for mild psoriasis, we have an abundance of topical steroid creams, medications made out of topical vitamin D and A that can be very effective.
Do those help mild psoriasis sometimes?
Very, very effective and very, very low risk, since they're things that are being applied to the skin rather than taken internally. That's always safer. And then there are actually phototherapy options even for mild psoriasis.
Phototherapy, that's light therapy.
Right, ultraviolet light is a well-known immune suppressant. Right, so in that case, X-track laser, for example, can be used. Ultraviolet B light can be given in small doses to small resistant plaques of psoriasis very helpfully. For more moderate to severe psoriasis, depending upon how much it's affecting lifestyle and how well topicals work and how much risk one is willing to entertain.
Sure.
Okay. Still, from an external standpoint, there is ultraviolet B therapy, what we call narrow band UVB. In the past, for patients in the audience who have psoriasis and they've heard of light therapy, it has been something that's been considered to be fairly risky as far as causing skin cancer. But the narrow band version of UVB seems to have a much lower risk of causing skin cancer.
So we're learning more about the ultraviolet lights. We're dividing it and making the ones that are safer.
Correct.
Treating for this.
Right.
So don't be afraid of it. Talk it over with your doctor on that.
It could be an excellent option for some people.
We had mentioned some of these new medicines on television that they say they really have possible side effects. That's what the government requires us to say. Right. So what are some of those and what do they do and how effective are they?
Well, very effective. The way psoriasis studies are done, you kind of have to quantitate what an individual person's psoriasis is like before a study so that you can see by how much they improve. So you'll see what's referred to as PASI scores, P-A-S-I, Psoriasis Area and Severity Index. Okay, and this is where you take a person and you see what percentage of their body is covered, and then you look at how severe their psoriasis is, and there are metrics for that, and you come up sort of with a number. Okay, and then the goal of these medications is to reduce that number. Exactly.
Can you get it down to 0 sometimes?
Well, we're getting close. Yes, yeah.
Isn't that great?
So with some of the older medications, which some people might be familiar with, methotrexate and cyclosporin that I mentioned earlier, you certainly got individuals who did very, very well, but overall, you were lucky to get 30 to 50% reduction in the PASI score.
So in resistant patients, the severe or the moderate to severe, it would help, but not as good as you wanted.
Well, that's right. And those medications had risk to the liver and kidneys. They could cause hypertension, a variety of different problems. So not perfect drugs by any stretch, but still ones that are in our armamentarium, and they're inexpensive, which these days can be a big factor, so we certainly can still utilize those. But
so what's new?
But the newer medications, okay, and these are getting to where some of them are not that new. I think you referred to the one that has the ad for psoriatic arthritis with Phil Mickelson, so that's Enbrel, okay, and certainly it is very useful for psoriasis. And it can get the PASI to near 50%. So a 50% reduction in the amount of psoriasis a person has is not an uncommon number with Enbrel. And also has, again, a low risk profile. Humira may even kick that a bit higher, up to about 75%. And then some of the newer drugs, Cosentyx and Talx and Stelara, which are all big names.
Stelara, Cosentyx.
And Talx, those can get up between the 75 and even upwards of 90% reduction.
So the newer medicines now, you certainly can't get those over the counter.
Right.
You see your dermatologist who's trained and can guide those medications. How successful are they? 75%?
75 to 90%, and many of them reduction in the score, meaning taking somebody with pretty significant psoriasis over large parts of their body and bringing it down to a PASI 90 is fairly clear, and I've seen it many times.
Where do people get information on this? You had mentioned earlier there's one website where there's information that is so good for people.
There's an excellent website that will cover all of these medications, and that's the website of the National Psoriasis Foundation, and it's psoriasis.org.
So psoriasis.org, and it's important to put the org on that. So there's a lot of information there that can help people.
Right through what I've talked about.
Tell me couple of stories of people that have had severe psoriasis that they put on a medicine and how they improved and how it changed their life. To me, this is as exciting as anything I've heard.
It's great because a lot of the patients, again, who are kind of abandoned, they felt like none of the things worked before. They were scared of some of the medications, and they've come in and we've been able to put them on these medications, and within a reasonably short period of time, it's been life-changing, which is great. But you did refer to risk, and these are drugs that are not without risk. Okay, they just don't cause organ damage. So when we referred to the new older medications with liver and kidney problems, that's not an issue with these medications. These work on the immune system, so it's helpful that we now know within the immune system more about what drives psoriasis. So, when you get the flu, that stimulates what are called T cells, and they begin to put off a variety of chemicals, cytokines, interleukins, that drive the inflammatory process and bring all of the rescue molecules and cells into the area to help clear up an infection, right?
So the same thing basically.
Well, in psoriasis, that system is out of whack, so we know that the immune response is too great. Okay, and the key chemicals are TNF-alpha and some of the interleukins. So whereas older medications used to wipe out the immune system entirely, these newer ones are more like little smart bombs that can drop in and just hit various specific points in the inflammatory cascade. So you don't get such a broad immune suppression, but the immune suppression you get is very profound in that individual area.
Meredith, to summarize, what I'm hearing is psoriasis can be treated. Even if you have severe psoriasis, the dermatologist can guide you. There's never any free lunch. You can take aspirin and you can have GI bleeding. So all medicines, but guided, it can be safe, wonderful, life-changing. Meredith, we've run out of time. What a great teacher. Any one sentence for a summary?
Go to npf.org and read more about it.
Okay, thank you for coming. You're a phenomenal teacher, and I appreciate your coming to the Dr. Bob Show. Meredith Overholt, psoriasis, new changes. If you've got psoriasis, know there's treatment, and remember those associated comorbid diseases. And now you'll want to stay tuned because we're going to be talking something that's really big time in my mind. Why are so many people becoming allergic, have sinus problems and sinus issues? We've got new over-the-counter medicines that are great for them. Do they work? And if they don't, why not? A lot of information for you. I want to thank Dr. Meredith Overholt. Wonderful discussion on psoriasis. Know that there's treatment available for you. And now for questions from you, the viewer, that I think will be important to your health. Question number one, Dr. Bob, why are so many people allergic? Let me talk to you about what's going on in the world now. We're having two things, lots of pollution and lots of global warming. With those two things, the immune system is developing more and more allergies. Pollution seems to be driving the immune system to develop allergy antibodies. 10 years ago, 20% of the population was allergic. Now, 30% of the population is allergic. In Europe, 50% of the population is allergic. And it seems to be pollution that's driving there. With global warming, what's happening, it's making where the growing seasons are longer and the plant mass is getting bigger because of the amount of carbon dioxide at ground level. So more and more people are becoming allergic. What's interesting with that is there are better and better medications over the counter. Let's talk about some of those over the counter medicines. If somebody has allergic symptoms, it would be stuffy nose, runny nose, sneezing, and congestion. It would drive the nose where you can't breathe. But there's other things that can cause that, like infection or like a sensitive nose. The immune system can also drive the organ systems where it begins to develop bronchial asthma. That's an allergic condition also. So what medicines are available for a bummer for a nose, for an allergic nose? Well, over the counter, we now have the antihistamines like Zyrtec, Allegra, Claritin. Those are antihistamines. If you take those, they don't take care of the congestion of the allergic reaction. They only take care of the itching and the sneezing. So those medicines and their generics are now over the counter, and so they're not good enough. People that just take those say they're not working good enough. So now there are intranasal steroids over the counter. Those are really the treatment of choice. There's Flonase that's over the counter, and there's Nasacort that's over the counter. There's also Rhinocort. All of these are cortisone sprays, and if you use those, it takes care of the congestion if there's underlying allergy. So despite the fact of taking antihistamine over the counter and intranasal steroid over the counter, 80% of people are not satisfied with their treatment of the allergic or the bummer for a nose. So what can we do? Well, first of all, there's no question about it. You've got to identify why your nose is bad. The only way you can do that is to see an allergist and get skin tested. The skin testing will say you've got allergy or you don't have allergy. It's amazing, in an allergist's office, some 40 to 50% of the people they see that come in with quote, quote, allergy symptoms don't have underlying allergy. It's a sensitive nose. So that patient has to be treated. The 50 to 60% that are allergic, the only way that you can get them better, that you can trick the immune system, if you can get them better without medications, is to do a desensitizing program. These are allergy shots. What the allergy shots do is they build up the protection. It's called an IgG4 blocking antibody. And the allergy antibody begins to fade into the sunset. When that happens, no allergy antibody, lots of protections, the symptoms go away. The allergy shots may not make the symptoms go away. They are inconvenient. You do have to go to the doctor's office. You do have to wait 20 minutes after the shot. So it's like every other treatment. There's no free lunch. But if your medicines are not working, be sure the diagnosis is correct. If the diagnosis is correct, then work out a program with your doctor, whether it be desensitizing or he tells you how to use the proper medicine. There's one medicine called Dymista DYMISTA, that has a topical antihistamine, put it on the nose where the problem is, and a topical cortisone medication. So right now, it's not over the counter. Hopefully it will be in the future, but your doctor can write you a prescription. Well, that's all the time that we have for this show. Remember the 4 things that we like. It's exercise, the most important thing you can do. What does exercise do? Reduces stress, helps us lose weight, makes us feel better. Get 7.5 hours of sleep. What does it make us do? It makes us feel better. It makes us perform better. What is it that we want to do? We want to eat properly. What does that do? Makes our body perform better. So we want to eat properly. And most of all, what is it that we like in the Dr. Bob Show? It's that laughter in your life. We don't spend enough time laughing. We know that the immune system indeed works better when people laugh. Happy people are healthier people. They don't have as many common colds. Their immune system works better. So find that person that you love. Tell funny stories. I like to tell funny stories. Giggle a lot, laugh a lot, have fun, and you will stay healthy.